Thank you for attending our presentation. The COVID-19 pandemic led to a surge in the demand for remote healthcare, but those from underserved communities may face additional barriers to telehealth, exacerbating disparities in chronic conditions, including type 2 diabetes or T2D. Our study aimed to examine factors associated with the use of telehealth during the pandemic among adults with T2D. Using electronic health records, adults with T2D were first identified. Next, all diabetes-related visits completed between March 2020 and July 2021 were extracted, including the modality of each visit, as well as patient sociodemographic characteristics. Patients were trichotomized based on the type of visits completed, and the primary analyses included multinomial regression models, which were computed to examine associations between telehealth use and patient sociodemographics. Just under 15,000 patients were eligible. Of those, a slight majority identified as Hispanic or Latinx, and over 80% lived below the federal poverty line. About half completed at least one telehealth visit. And when examining visit modality by race ethnicity, the highest rates of telehealth were observed among Hispanic and Middle Eastern or Arabic patients, and the lowest amongst Asian Pacific Islander and Native American or Alaskan patients. Women completed more telehealth visits than all other genders. In multinomial regression, women, Hispanic, and Arabic patients were more likely to engage in telehealth versus completing no post-pandemic visits. Similarly, women and Arabic patients were more likely to complete telehealth visits versus inpatient visits when compared to all other gender or racial or ethnic groups. Further research should consider additional factors that may influence telehealth access for underserved communities in order to develop strategies that promote equitable access to healthcare.